Hey, what is up, guys? Today we're going to do an interview with a small business owner and dentist. I've actually interviewed this man before, Dr. Darryl Torculas.
Hello, hello.
Darryl, can you give just an introduction about who you are, what you do, where you're from, so we can know a little bit more about you?
Yeah, so my name is Darryl Torculas. I'm a general dentist, and I recently acquired a private practice about a year and a month ago down here in San Diego. So yeah, it's
Cool,
been
cool.
about a year, and then yeah.
Well, let me start with this. This whole coronavirus thing kind of affected everyone's offices since I guess last week. Were you open at all last week? Monday, Tuesday, Wednesday, anything like that?
I was open up until Tuesday, but that's because I didn't work at my office on Monday. I'm still associating. So I worked a full day Monday. And then that office, they made the decision to shut down or temporarily close and see emergencies after I worked. And then Tuesday, well, going back to before that, on Sunday, I decided for my own practice that I was going to temporarily close and only stay open for emergencies Sunday night. And then Tuesday, I went in the office, talked to the staff, and told them, hey, this is what's happening, this is what's going down. And then we pretty much just put systems in place. I saw the two post ops that I needed to see in that morning, and then everything else was just getting things ready for a closure, slash, if there's an emergency, then a chair is set up for an emergency. But other than that, yeah, I kept the phones on, and I'm pretty sure we'll talk more about that, but that's pretty much what happened. And then they have access to me. So, yeah.
So to give it some people the idea of about the scale of your office, and when did you open your office, and how when do you expect to come back to work?
Yeah. So I've had my office officially closed on February 15 of 2019. All right. I have a three operatory practice, pretty small, and I have two employees, one front desk and one assistant. So it's a pretty lean office, 600 square feet. Oh, actually, no, 700 square feet. So pretty small. And and when we're gonna open up, I think right now, the CDA says 3 weeks. So right now, I have patients actually scheduled from that 3 week mark. Now, I think it's going to be even longer. So I'm going to wait till this week to see how things are, and then we're going to may have to postpone it. And that is now a tricky scenario because I don't want to have to keep. I have patients on the schedule for 2 weeks right now. So now, I don't have to keep pushing them out, so I don't know how to approach it in terms of, hey, we're going to schedule out for another 3 weeks. We'll put you on the schedule and then keep pushing out. So I don't know what the best way to approach that. I have some ideas that we can talk about, but yeah, that's pretty much it.
Have you had any patients give you pushback, as if maybe they're a little upset that they can't get their dental work done right now? And how have you approached that type of conversation?
So, the Sunday I decided to close, I was open Saturday. And then that weekend, was when the NBA and all that, the news were like, hey, we're closing things down. So then patients caught on. Saturday I had a full hygiene schedule, 2 columns with the hygienist, and pretty much all the patients rescheduled. So they were aware. They're like, hey, we're going to let this blow over. Like, we don't want to come in. We don't want to get sick. But some patients are also calling, be like, hey, I want to come in for a cleaning. So, and it's because I don't think they really know what's going on in like I feel like they assume that since we're dental and we're in healthcare that everything's still going to be the same. But we put notes, we put the CDA printed out on our door, called, texted each patient, letting them know, hey, we're still open, just only for emergencies. But yeah, some knew, and also some were like, hey, I'm just going to stay home and reschedule until this all goes back to normal.
Yeah, I had the same thing. We had some patients that were actually kind of upset that we had our hygienist closed down, and then they were calling to see if they could schedule with a certain hygienist. They weren't there,
Hmm.
and and verbally, our front office staff were letting us know that yeah, they were getting really upset. But I think now more and more people are becoming more aware about how serious the COVID-19 virus is,
Oh yeah.
and they're starting to be maybe even a little bit scared to come into the dental office. Um,
Yeah,
how are we going to manage that?
especially since it's aerosols,
Yeah,
we work with scalers, water spraying. So I agree. And I mean, it's also like we don't know what's going to happen in terms of the dental landscape. So as a patient, I'd be like, if the hospitals can't handle it, what makes me think a dental office can handle, you know, what's going on?
absolutely. I think it is still very early, and that's why I wanted to do this interview with you, and maybe we can do an interview 2 or 3 weeks down the line. So everything
Hmm.
is still changing and it's up in the air. Um, but I think one of the things that we're going to have to do in the dental industry is, first of all, we have to figure out how to safely treat and see our patients, and treat their needs.
Hmm.
Some people have emergency issues where they have broken teeth. Some people are in pain right now, and a lot of dental offices are closed. So we have to figure out how to treat them safely. But also, if we're looking maybe a year or 2 years down the line, doing maybe a little bit more elective work like prophies or fillings that maybe aren't that big, how can we ensure our patients that our office is safe? Is that something you've thought about? Because
Yeah.
I think that's going to be a big thing that the dental industry as a whole is going to
Yeah.
have to do.
No, I agree. I completely agree. I think the way we practice dentistry after this whole thing, if OSHA figures things out, CDA, figures out how we're going to treat patients, it's all going to change. I know, there's been studies about ozone. So ozone kills the viral load or reduces the viral load of COVID. So some practices have already implemented that and they have that system. Could that be a standard? It could possibly be. The hydrogen peroxide, I've seen patients now asking for them or asking what their thoughts are. I've seen people go to the stores and buy the bottles of hydrogen peroxide. So there's a lot of things, how do we properly screen, and if we don't have some sort of solution for COVID-19 and this becomes a seasonal thing, then we may see this, another wave of, infection next year, wintertime, and it could possibly happen. So then are we ready for that dip? Can we handle that as a practice? Do we have the funds to implement these new strategies or protocols? So it's a lot of things to consider. But I think the way that we practice dentistry is going to change for sure.
Yeah, I think there's also going to be an overhaul on how we look at masks to protect ourselves as well.
Oh,
Right
PPE
now,
for sure.
yeah.
Yeah.
I mean, I know that we do our best to protect ourselves, wearing our mask, our loops with our side mirror protection, all that kind of stuff. But now we're realizing that a lot of the level 1, level 3 masks aren't protecting us from the COVID-19
Hmm.
virus. And these respirator N95 masks, they call it, are. So that, we might have to do definitely the way we wear our PPE. I think is going to change. I
Right.
actually do have an N95 mask. I have one, and I tried using it, and it's actually really hard to breathe in. Believe it or not.
No, yeah, I've heard that, the lung capacity at the end of the day, you're gonna have a hard time breathing.
Yeah,
So is it suitable for daily practice? I don't think so. If that's gonna be the issue. So there has to be a different way. The other way I see this going about is, dentistry in an OR operating room setting, or at least have it set up something like it, because they can handle, the aerosols and all that. So I don't know.
yeah.
It's a huge unknown.
Um, I've thought about a lot about the different types of dental practices out there. There's some practices that operate on a lot of volume. They see, let's say, the Medi-Cal population. Then there's
Hmm.
some boutique practices that maybe they only do cosmetic work, veneers, and things that are purely elective. And then
Hmm.
there's the practices that see a variety of insurances as well as private patients and things like that. Um, curious to see what's your take on the future of that, of these different models of dental practices. Will one be more affected than the other? Do you think that this will all blow over? What are your thoughts?
I think corporate dentistry is going to have an even bigger presence in the dental landscape because cash is king, right? So what? They're funded by private venture capitalists, so they're going to want their money. So either A, they're just going to throw more money in and then take all the patients. The smaller, mid-sized dental offices I feel like maybe the ones that are going to struggle because then they have insurance, like, oh, now I think the medical Medicare population, they'll be there. I think they're just going to go somewhere who's going to be cheaper because I mean, it's a trickle down effect. If I don't have money or don't have dental insurance, I'm going to go for the cheapest one for now until I can afford until things come back. So I think the ones who can handle that population will probably be successful. It's going to be like that middle, like, okay, the mid-sized dental office that takes a bunch of insurance, but if these patients are like, oh, I can go a cheaper option, sure. And then they don't have money to operate their offices. And then you have the corporate offices that have a lot of money. You can throw money. Cash is king, right? So they can throw a lot of money into these offices, marketing, all that, and just take all those patients. So I think there's going to be a pretty big divide, and not a big divide, but I know there's going to be like a shift in the dental landscape. In my situation, and I'll speak from my experience or what I've seen, like I'm running a pretty lean practice. So low overhead to begin with. I was seeing fee for service patients. So those patients were already like I already had a low pool of patients. Um, but I had low overhead, low staff, like two-person staff, three including me. So this whatever's happening now, I can afford to absorb the hit for a little bit. But then, foreseeing maybe like in 3 months from now, that may be a different story. But I can still have the ability to take add-on insurance.
That's,
So
yeah,
versus right now, if I was already in network and I'm like, oh crap, like they're leaving, like if you're playing that insurance game, I don't know because I'm not in
that's
that.
kind of what I'm getting
Yeah.
at. I mean, I don't know the answer. This is still very early. We may be jumping the gun, but I
Right.
do believe that a lot of people are going to be accepting a wider variety of insurances in order to
Hmm.
keep the volume of patients in house. I do think that a lot of these elective procedures, um, people are going to be more, depending on how it goes. If we enter depression, people are going to want to keep their cash as much as possible. So they
Oh
may
yeah.
want to prolong things that maybe aren't necessary or urgent immediately. If there is, let's say, a cracked tooth that we're watching, or
Right.
let's say there's an aesthetic case where the person doesn't like their smile or they don't want to do orthodontic work or things like that. So I think that's where it is going to go. So I do expect a higher increase in practices accepting more and more insurances in their
Yeah.
office. But once again, it's all
Yeah.
speculation, and
Yeah.
it's just my
I
thoughts.
mean, I mean, the patients will be there. There's going to be dental patients for us now. I guess in the terms of a patient, which route am I going to go? If I've had cash, if I'm the patient right now, that I'm going to go support small businesses. Like I have some extra funds. Those are most likely the ones that are okay, and be like, you know what, I'm going to go do my cosmetic case. But for the ones who are struggling, it's like, oh, like some jobs, are laying out people, and that is that one person, they're gonna think twice about, oh, I remember him talking about a crown, but I don't know if I can afford it right now, So priorities will change with
Yeah.
that.
Well, that's interesting. Well, I guess moving forward, I know that you're a small business owner and you acquired your practice. What was it? Maybe a year ago to date, close
Yeah.
to a year ago to date.
Hmm.
So things have definitely changed. I know that there are a couple laws that are being debated right now in the Congress. They're debating on a stimulus package for everyone,
Hmm.
and they're talking right a lot of concerns in the dental community regard the FMLA package. I think that's what it is, FMLA, where
Right.
they're talking about business owners that have less than 500 employees. They're going to have to pay them, I believe, up to 10 weeks. If they need to take care of their children who are sick, and
Right.
it's like an aggregate of $10,000, $200 a day per employee. Sick pay is now like what is it? 2 weeks you're allowed to take.
Two
You have
thirds.
2 weeks
Oh yeah,
off
yeah.
or something like that. 2/3 pay. So, and I think it's like a maximum of what, $200 a day or
A
something like
day.
that.
Right.
What are your thoughts on this? Now, I know that a lot of dentists and small business owners like yourself would like that. We can't afford to pay our
Right.
staff for that long. But then there's hygienists and other, like dental assistants that say, "Oh no, we need this." So there's this kind of like, you know,
hmm
what's your argument for or against it?
Um, I mean, as a small business owner, that is like I did the math. I'd be out at least five, six, $7,000 just giving it to them. Um, if that was the case, if I followed that. But also, I learned recently, so these things may have changed from when we had this conversation, that small businesses or dental offices, I think, may be exempt from doing that, from having to pay that sick leave. Because I know they changed it from 500 or less employees to now it's like 50 or less employees or something. But in terms of laying off people, I mean, it may be the smart decision. Now, if you're the business owner, it's like, okay, I'm gonna lay you off, and you trust that person to come back, then sure, it'd be a smart business move. You're gonna have your practice at the end of it, and then they have the ability to come back and practice. Let's say you keep them on, right, and then you don't have your practice at the end of all this, then
Which is a serious
maybe,
concern. The
yeah, it's
concern is
like,
that this may last years, and you have to shut down your business. Is that
right.
what you're saying?
Right. And so the thing here is, at the end of this all, do you see your office standing? Like you want that dental home for people you want people will come back and support you. Now, like how are you going to be able to get that position and how long is it going to take from now? I mean, I don't know. But I think trying to survive or not survive, but trying to thrive in this type of environment and make sure that your dental office is still there so that you can have your employees come back. You can have those patients come back. I think that would be a great service to the community. And then if you lose, and then like I said, if you lose, then it's like, okay, your patients have to go find a new dentist. They don't want to have to go through all that. And then there's a whole cycle. Oh, my dentist, like I don't want to take care of my teeth, or like I'm too lazy. So then now the patients fall off. So now the question is, are we doing a disservice to them? And I mean, there's a whole thing on that. So I think you got to do what's best for your business. I mean, you also are providing for your family. So what are you going to do what's the best interest in you? You
Now,
know?
they are saying that the government may pay back all that lost time.
Right.
So,
Right.
but it's still up in the air. So
Yeah.
once again, we're kind of speculating now. We don't really know
Yeah.
all the details. It's changing every single day. So probably a day after this,
Yeah.
interview that we're having, it's going to be something totally different.
For
But
sure.
I think it's important to think about so that you can figure out what to do when the time comes. So yeah. Okay, well, I have another question. I have a list of questions on my phone. Okay, I'm just scrolling through
Yeah.
them.
For sure. Yeah. Yeah. Yeah.
Okay, this is something that my wife, who's also a dentist, Dr. Ashley, she
hmm
told me to ask you. How do you think this is going to affect new dental school graduates,
Ooh,
who, by
that's a
the
good
way,
one.
cannot take
Uh,
their boards? Their boards have been delayed.
yeah.
So what's
So
going to happen
I
with that?
honestly think so. The D1s, D2s, I mean, those were like textbook didactic stuff. So other than lab work, I think they'll be okay. I mean, probably extend a semester or just cram. For the new graduating dentist, I mean, they're probably on the end of their clinical portion, so they still probably have to get the requirements. So there may be adjustments in terms of like satellite clinics. Hey, go do your a month here in a satellite clinic, or go here to work for us for like these first few months or so. The job force, uh, that's gonna be tough. I mean, doctors, I feel like nowadays they may want to keep everything in house and do everything themselves. I mean, I don't know. There's a decision to be made where it's like, oh, I'm losing a significant amount of time in clinic. Now, how do I gain all that back? And be prepared to work. And then this could also be a good thing for small business owners like, oh, we got these new grads coming out. I want to capitalize on the volume of patients, so I'm gonna go hire this new grad. And then, they can set the standard and be like, you know what, I can't afford you the market share before the standard market price. I'm gonna go lower $500 to pay for a dental student, like to work. So there's a lot of factors. I think it's gonna be hard for these new doctors to find a job, I think, especially in
Yeah.
this time of
Uncertainty.
yeah,
I would say so. I would agree. I mean,
yeah,
without being too like the world is ending, I do think
right,
it's going to be a little bit more difficult for them to not necessarily find a job, but let's say find a good, well paid, well paying job. I
right.
think there'll always be jobs. A lot of these corporate companies are
I
always
mean,
looking for new
yeah,
dentists.
and this is how
So
corporate's gonna do it, right?
yeah,
Hey, got these new grads. I got, like my associate doctors or the doctors I work for. I don't know if they can afford another doctor now because I know they're looking for one. They've interviewed a few people and their start date would be July after school, but it's like, well, are they going to have enough work for them to do? Can they
yeah.
afford it now? Um, yeah, it's going to be tough for those new grads.
Well, well, the good thing for new grads is that right now the federal loans, I think it's what, 6 months you don't have, oh no, excuse me, 2 months or 60 days that you don't have to make any payment. And I believe it's 0% interest right now.
Hmm.
So
Right.
that's the best thing that can happen for federal student loans. And I hear there may be some more incentives or a stimulus that's going to help people that have these massive student loans. I don't know what's going to happen with student loans. I think something's going
Just
to happen.
get rid of it all.
I don't know. Yeah, I know. I wish. I don't think that's going to happen, but I do think they're going to give some breaks, whether it's like a couple $1,000 breaks on your on your federal student loans,
Hmm.
which is annoying for people like me who have consolidated their loans and already went. I refinanced my loans
Right.
and consolidated it.
I mean, they'll probably consider all that, all the range of what people did.
Yeah, maybe. But so yeah, and I do know that since the Fed interest is at 0% right now, that all these small banks are allowing you to refinance loans at a smaller interest. So that is good news. But I really don't know how long that's going to last. It may last a very long
Hmm.
time. The interest rates probably will go lower depending on how this whole thing plays out. Um, what are your thoughts? Are your loans? I forget. Are you refinanced right now? Or are you still in the
No,
federal?
I'm still in the income-based repayee.
I have a
So
lot of my colleagues are on income based right now, which
yeah.
is actually a good thing because right now, if you're not making income, you don't have to pay anything, right?
Right. Yeah. So I mean, it all depends on how you want to go about it. But I've just been doing that until the business takes off, and like, okay, then I can start to afford possibly looking into refinancing or putting more chunks or chipping away at the loans. So yeah, I really don't know. I hope we get a little break from that. But that's a lot of money. Any money could help with those student loans.
Okay, here's another question. Should we? Okay, you and I are part of a variety of Facebook groups. I know there's like the coronavirus and dentistry group. You were talking to me earlier about an email group of the San Diego Dental Society. Um, one of the groups that I was part of might have been Dental Nachos or something. One of the people put out a special consent form that they created for people that want to be seen for emergency cases at this time, which basically says they understand the risks and precautions of being seen at the practice, and that they're
Right.
willing to get the treatment needed to get them out of whatever pain they need.
Right.
Is this something that you think is necessary at this time? What's your thoughts?
Um, so I've thought about the consents and all that. I think it goes to proper screening. I mean, you're a healthcare provider first, so you have to determine like, okay, does this really need, to be addressed now or later? And then once you figure that out, then proceed with caution. Now, with the consents, I don't know how effective that would hold up in court. because I'm looking at my liability and malpractice insurance. Nothing in it says, hey, in any time of a pandemic, we are responsible for X amount. No, I doubt that they would even cover. So that's a tricky line because let's say, hey, the patient did sign the consent, but then they find out nothing is, you're not liable. Like there's nothing covering your insurance. Then, if that patient wanted to get really aggressive and blame you for it, then you mean that could be a huge problem. I'm hoping, there would be some sort of solution to that. But that is a big concern, trying to treat patients and then if it gets traced back to you, then what, And at the end
Okay.
of this too, it all depends too, like as a practicing doctor, like I know some offices are still functioning, normal, but then it's not the owner that's, going to take the hit. It's whoever the treating doctor is. So you can have that consent. The office will be safe, but you as a practitioner might not.
So if you did have, let's just go over a scenario. We end the Skype call. Someone calls you. Hey, Dr. T, my favorite dentist in the world. Love you so much. You're the best. I just split my tooth in half, and the
Hmm.
pain is incredible. 10 out of 10. Can't sleep. I'm crying right now. I need you to help me. What are you going to do?
I mean, I would call, triage. Hey, you 10 out of 10. Okay. If it's a split tooth, hey, come into my office. Let's take an X-ray, and that tooth may need to come out. If it's an extraction, I'm more likely to incline to do it because you're not really spraying aerosols or anything. Um,
So
I
you're
would do
willing. You're
it.
willing to come in and treat the patient
Yeah, if they're in
in these
pain,
emergency situations.
yeah. I mean, the tooth's in pain. If he's in pain, and like, come on, like, you gotta also understand. You gotta be empathetic too. We're healthcare professionals, so hey, you know what? Come on in. Let's take a look and see what we can do. Um, because if this is gonna go on, I'm not gonna play the game like, oh, let me treat that tooth 3 months from now. They're probably gonna go somewhere and be like, oh, Dr. T was that dude that he's just gonna wait, listen or do whatever. They say 3 weeks or whatever, but I'm in pain, So then there's gonna be things like that. That's gonna be your ethics will be put into question for sure. But you gotta do the right thing. Like if it was my mom or my brother, I'm like, let's go, let's do it.
Yeah.
Hopefully the patient that's reaching out to you understands, okay, I trust Dr. T, you know, he does good work, and then I don't have COVID, or like the patient will most likely, you know, come forth and be like, hey, I've had a fever or whatever, like let you know. And if that's the case, then that'd be a different story. But I'm hoping the patient wouldn't be like,
Yeah. See,
hey,
that's the problem is that we don't know. We don't know how
mhm,
this virus, so many people are asymptomatic and have the virus and it can spread. That's why it's so contagious and so dangerous. Yeah, I think it's hard because right now the PPE are needed for those on the front lines at the hospitals. But eventually there's going to be a time where we're going to have to protect ourselves and our staff because we have
mhm,
to assume that every patient that comes in has the virus. And even
right,
before this, it's not like just because someone writes in their health questionnaire that they are no, 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 everything's healthy. I treat every patient as if they have something serious. You
oh
know,
yeah, you
to
have
protect
to,
myself, to protect all the other patients in the waiting room, to protect everyone. And I
hmm.
think you have to look at everyone like that. So the
I
only
mean, going
difference
going
should
back to
be
that,
the aerosols you know, wearing these protective masks, and also I don't know what else. Maybe ozone. I haven't heard about ozone therapy as the ability. I know that there was an endodontist on Instagram who was promoting. Maybe that was what you were talking about, killing the virus. A machine that was attached in their office.
yeah.
But I don't know. I don't know what the
No,
future
yeah, I
holds.
agree. And then you know what? Dentistry may be one of going back to the type of practice, you may end up going to doing a like boutique style. I'm only see one patient at a time. Patient, you know, one patient at a time. Where you know what, just me and my staff, one patient here in the lobby into the chair. So you're minimizing
That might be
that.
true. Maybe they have a limitation per square feet. I don't
Yeah.
know. I mean, I haven't thought about that, but maybe there's a limitation of how many
Just
people you can see
yeah.
per square foot in the office.
I think it's gonna all go down to patient perception. Is this office clean enough to handle COVID? Am I gonna get COVID from this office or what?
Yeah. Okay, here's a good one. I have about four more questions and we're done. Do you think the banks are going to be, is it going to be harder for new dentists to get loans now that these banks don't really know the future of dentistry? Dentistry has always been, a lot of lenders have always been willing to
Willing?
give people loans because dentistry, it's so, they're not likely to default on their loans. But that may all change. How do you think lenders are going to treat people now?
I think lenders are still gonna be willing to lend money. I just think now how you practice dentistry is, or how you're gonna use that money. Or I guess it goes up to their business plan. Um, it's gonna prove to them if they're gonna be willing to lend. I think it's still gonna be there. I just think now we have to figure out a way to show that we can get that money. I mean, it's gonna be different. So yeah.
Okay. All right. You know what? The other questions we actually kind of already talked about. So let me just ask you two more questions. What are you doing during this time to stay, number one, productive, and number two, happy?
So I still treat it as a working day, so I wake up the night before I get my planner ready, which I have somewhere around here, down here. And, I do my to-do list and what I'm going to do. So usually, wake up at 8, eat breakfast. So from like around 9 to 5, 9 to 6, I'm doing business things, working on the office, which I now have more time to do, studying. So it's broken up into like 45 to an hour time slots of just things I wanted to get into. So I'm not going too crazy. Yeah, the way that I look at it is this is an opportunity, to work on the business and try to anticipate, well, not try to anticipate, but just be ready that if the dental landscape changes, that the work that I'm doing, it can translate into that. Teledentistry, webinars, or whatever, like remote virtual consults or something like that can now implement because I am to whatever's going to happen after all this. So I'm working on that and then just working out. So me and my brother just work out after because he gets off at 5 from his calls or whatnot. So it's like, all right, let's go work out, eat dinner, and then a whole lot of Netflix and YouTube. Actually, a lot of YouTube. I've been watching a lot of YouTube tutorials, man, like just learning.
Tutorials about what?
Right now, like my previous hobby was like toy modeling.
Oh,
So I've been
okay.
learning toy models and stuff. So I was like, oh, let me get back into it. And so then I've been watching a lot of YouTubes of like how they paint it or like how to add texture and all
Oh,
that.
that's
And like,
cool.
like making it look like it's been through like add character, So like just
Yeah.
things like that. Um, yeah. And then just working on the business, working on a few things, So yeah.
Cool. Cool, man. Yeah, I'm getting back on my YouTube game. Just trying to make videos. I'm trying to make about
Yeah.
two, like one video every 2 days, which is kind of ambitious.
Hey, we need to talk about that after this call. But no, I think YouTube is
It's
it's a
hard,
good
but you know
channel.
what?
Yeah.
It's fun, and I actually took a hiatus from YouTube. Like the last video I made was in January before I started during this whole pandemic thing. But it's been fun, and it's nice to just grow the channel, and also it's a great time to do continuing education courses if there's some type of specific technique you want to learn. So
Oh yeah.
I do have a couple of those that I want to do. I don't know how long it's going to be. Hopefully not too long
Too
that
long.
we're kind of up in the air, but we'll see what happens.
Yeah. No, I mean it's a good time to pass.
All right,
This
man.
time.
Well, I appreciate you coming out here for the second amazing interview. You're like my number one dental interviewer right now. I love it.
Dude, I love it too, man.
We'll probably do one in maybe a couple weeks. Hopefully, we're at work and we don't have time to do one.
Yeah.
But if we're not, we'll do another one. Why not?
Hey, man. Yeah, dude.
I appreciate your time. Thanks for doing the interview and stay safe and healthy.
For sure, man. Appreciate you too.